Thank you for joining us for the second part of a four-part series, Pilgrimage Through COVID-19. Last week, we had a wonderful conversation as we discussed healthcare and how healthcare organizations have been impacted through and the issues that come forth from COVID. If you were not with us last week and would like to hear and reflect on that particular conversation, please go out to our website, DurhamCares.org, and that conversation video is out there along with a reflection guide. We invite you to join us for the rest of the four-part series as we continue to discuss some of the ways that COVID has impacted our community. This morning, I'm very excited to have Delvin Davis co-facilitate.
It should be from, I believe it should be from Zoom.
Okay, Ben, I hear you. Sounds like another guest is coming on, but I'll keep talking. I have Delvin Davis with us this morning, and he will be co-facilitating as we discuss policy and how that has been impacted with the virus, and how we've had to come up with rules and regulations and all of those things. We will have with us this morning as our panelists, we have Jeremy Collins, Director for the Governor's Public Engagement Office. We have Deidreana Freeman, Durham City Councilwoman. And we are expecting Tony Hayes, Tribal Chair of the Occaneechi Band of the Saponi Nation, and Miriam Vallier, who is in the midst of fighting COVID as our witness today. As with the first conversation, our overarching question is one that frames the Durham pilgrimage of pain and hope. How does your story, the story of the city, and God's story intersect? And how that is being played out in the midst of this pandemic. So I will start out this morning, and I will ask Mr. Collins if he will be the first to share with us as to how the work that he does. So if you will share just a few minutes, the work that you do and how this virus or pandemic has impacted the work that you're doing.
Thank you. I'm gonna start just with the word of prayer for a moment. God bless the why behind us, the work before us, the friends beside us, and the love between us. Amen. I come at this work, first of all, thank you for having me. My name is Jeremy. I'm from Eastern North Carolina, really small town. Delvin is my homeboy. He's from Washington County. I'm from Martin County. Grew up in the same church almost. And this work, my role in the governor's office is to direct the governor's office of public engagement. And what that traditionally has meant, prior to this role, many official executive offices will have a constituent services person. And this person is tasked with essentially sharing the executive message with marginalized populations. And we have enhanced that role, created a new office, to Governor Cooper's credit, to be more of an exchange of information. We call it public engagement because my role is really to advise the governor on policies that affect the public, and then to work with community groups to build solutions that address kind of data-driven ideals. And so when we talk about COVID-19, COVID-19 exposes a number of issues that our community groups have been educating on and praying about and working toward for decades, if not since the founding of our nation. So I have the great fortune of saying that COVID-19 has actually become a witness to much of the work that we are doing, right? And so when we talk about disparities in housing, disparities in healthcare, disparities in economic growth and economic incentive, we talk about job creation, food deserts, you name it, COVID-19 has essentially allowed the community advocates to step to the side and say, this is what we've been telling you since the beginning of time. And it's now becoming undeniable. Here's the problem, though. The problem is that because we live in a, for lack of a better term, segregated, still kind of white supremacist driven society, although it's undeniable, it remains to be denied. And so this work had the COVID-19 on a personal level. I've lost one or two family members to COVID-19. I've also lost some dear friends, dear brothers, a couple of fraternity brothers. We've also, as many African Americans, Black folks, I'm gonna say it that way. Many of us in the Black community, we've also seen trauma in the mental health space, and so it's our friends and our family members who are may not be down from kind of physical ailment with the illness, but they are suffering in the mental health space from despair, not able to access many of the incentives or recovery measures from COVID-19. I say this to the governor regularly: the people who are hurting the most health-wise from COVID-19 are also benefiting the least from the recovery measures as a result of COVID-19. And so, I know there's other folks that are going to talk, but I want to make sure that I get this out there. From a policy perspective, what my role in the governor's office is to push for a revolutionary reform that says any underinsured North Carolinian who suffers from diabetes, hypertension, high blood pressure, a pulmonary illness, any underinsured North Carolinian who suffers from any one of those pre-existing conditions should receive health care. Not just information, not just data, should have access to health care, and not just at a FQHC, a federally qualified health center like Lincoln Community, which is a great place, but also a place that's under-resourced and overburdened. If you are in North Carolina and you are underinsured and you suffer from one of those pre-existing conditions, you should be able to walk into a health provider and get health care, because that's what we know is the greatest, more than socially distancing, more than washing your hands, more than wearing a face covering. If you have one of those pre-existing conditions, you are essentially a dine-in sign for COVID-19. And so my role has been to share that information with the governor, to pound on that issue, to highlight racial disparities, to talk about how the SBA loan situation is not benefiting small hubs, small historically underutilized businesses, Black-owned businesses, women-owned businesses, minority women-owned businesses for the most part. And so I have been living in that space over the past 7 weeks. I appreciate your prayers, but also want to draft you up to continue doing the work that you're doing and be more wind at our back. Like, to me, that is, we're going to lose a lot of people from COVID, but we could lose a generation of wealth, and we could lose a generation of stability in the wake of COVID, just because of the things that many of our communities will not be able to recover from, but for or unless we put in protections that particularly address those communities. So I think I've spoken too much, but I'll leave it there for right now.
That was good stuff. Thank you. Thank you so much. We're going to come back to you. I'm going to switch over now to Deidreana.
Yes, I'm here.
Okay. Thank you for being here. Hopefully you had an opportunity to hear Mr. Collins. And I want to bring that question forward to you as well, as to how, as a councilwoman, how has this impacted your work and the work that you've been doing in the past? So if you could answer that for us.
Sure. I really appreciate the opportunity to speak to you all. Thank you for inviting me to be on the call. I would have to say that it's interesting how folks are responding to COVID-19. I think because I had been responding to COVID-19 in a different way since I've been in office, I was prepared for this. And so just noting that prior to COVID-19, there were folks experiencing the same situations, outcomes that we're trying to kind of mitigate right now for everyone. I've been working in the community to make sure that people who are at the margins have what they need and can move out of poverty into wealth. And so out of poor health into good health. And so these are things that I've been doing already, and I've just been using those same practices and networks and community to try and push for more of it in COVID-19, recognizing that those who are at the margin are most often the ones who get left behind and receiving the supports that they need to do just what everyone else does. I mean, even children in schools, those kids that are at home today with their parents who have to stock the shelves or, tend to a parent or as a caregiver to someone as a health provider. They still have to work, and whether they're essential or whether they're home with their child, they still have to provide the same resources or the same learning tools and resources that kids need. And it's also, it weighs heavy on my mind, the disparity that already exists and how we're gonna come out of this. I would say that I've been pushing in hard on the economics of this, recognizing that the small businesses that are shut down right now, aside from the health aspect, have to recover. And what that looks like, on the other side of COVID-19 concerns me greatly, because I know that the big box stores will be fine, and those who can apply for PPP and all EDIL, the payment protection, the payment protection plan and the economic development and all of the programs that are available through the federal government, they'll manage to make their way through. But for those who are cash operating, smaller businesses that don't have the wherewithal or the manpower to focus on spending 8 hours on an application, what does it look like for their business? The barbershop, the lawn care provider, those who have food trucks, there's caterers. There's so many who tend to be people of color. And so I've been pushing in through a group of us that continue to work in community, because it's government is pretty slow. I'm not one for waiting. I jumped into action and pushed through the group that we pulled together, the Faith Summit last year, to have conversation about what we could do. And we developed a fund to start supporting some of these smaller Black and brown businesses. And in the 3 days, I want to say that the fund has been open, we've managed to raise about $6,000, and we'll continue to keep pushing to get more funds allocated and to have more people in the community who don't need those stimulus checks that were sent out, or all of the stimulus checks that were sent out, to redirect that to support someone else in the community who will need it. And it's incumbent upon us all, to take part in what happens, and to like lean on each other and to push each other to do more and to be more, because if we don't do it, I don't know what else we can do. I do know that the city has allocated about $5 million towards COVID expenses, and that's hardly enough, but it's a start. And the county's reviewing, what their commitment will be. I'm very clear that the health department is taking the lead on the health aspect of this, and I'm following their recommendations. I don't question them in the way that I hear in my community, which sometimes is off-putting. And so I'm happy that there are more people than not abiding by the governor's orders and the county and city's orders, and even in the mask, wear a mask and all. It's important to note that the more that we do, now can prevent the deaths later, because it's about public health and how we work together to make sure that the entire public is safe. It's not just about you. And so, you know, there are a lot of people who may look healthy, but they go home to a young child, you know, or a senior at home, and they need the same care that we would all want as a person who does not have full health. So I'll stop there.
Thank you, Councilwoman Freeman. Mr. Hayes, I don't believe is on our line, so I'll open up. Delvin, would you like to jump in and ask some questions at this time?
Sure. So thanks again, Jeremy and Deidreana, for coming on. I really appreciate what both of you were saying, especially how a situation like this is exposing a lot of what we already knew. It's widening the disparities that were already there even before the crisis. And I think, you know, when we're talking about policy and political decisions, a lot of times it gets buried in a conversation about items and statistics and, you know, how do we measure impact and stuff like that. But I think we can't really lose focus on policy as a representative of our values. And, you know, how do we establish those values? You know, COVID is something that is impacting lives, obviously. So it's like, you know, how do we as people that vote for policymakers and decision makers, how do they value the lives that are being directly impacted? So, so I guess my question from a political standpoint, let's kind of talk about like the, I guess, challenges that you see. The politics are different on a either state level, local level, and obviously on a national level. But sometimes politics gets in the way of really doing what we need to do for people on the margins. And sometimes, you know, we can get around that in some ways, and sometimes it just gets kind of hard. So, so either Jeremy or Deidreana, just, you know, what kind of challenges have you seen or heard of that that really need to be mindful of from a political standpoint to really represent the needs of people that are directly impacted by COVID-19?
I think I would say that I experienced this in a moment last night, realizing just how far away from our values our county has been acting. And it's concerning the way in which our county manager and county commissioner have or have not been addressing the issues around racism that were raised, and noting how any illness, any sickness, any virus, any invisible killer, enemy, whatever you want to call it, can spread through our entire system. All the people in this community are watching us. All of the people in our community are feeling this. And what we do to Black and brown people matters. What we say to Black and brown people matters. How we respond to Black and brown people matters. These are the things that in this moment speaks to what our values are. And honestly, I've been disappointed, but I can't say I'm surprised, because we speak in ways in which that are feel good to one another. But in reality, the way in which people are living today in Durham, North Carolina is unacceptable. And the highlighting factor in this being this virus, being COVID-19, when you're without health insurance, when you dependent on SNAP benefits, when you're dependent on unemployment benefits, and we are like the second lowest in the country. I mean, what we do to the least of us is reflective of who we are and how we work. And I can't say in any more words like how in so many ways, I am disappointed. But what I am so proud of is how all of those people who are at the margins are pulling together. All of those people who are, you know, who understand what our values are standing up. They're standing with one another. They're providing resources. I mean, I've been watching people, you know, bring packages of tissue to one another. I've been watching people bring food to one another. I've been listening to a family with COVID-19 receive meals from another member in the community, based on just knowing that they, you know, they're struggling. He just decided to make meals for them. And they're outside of that natural or paid for nonprofit system. They're not all just sitting in the system of, you know, charity. There are actual people who are digging in and doing what needs to be done, taking care of one another's kids. I often joke that my neighbor, she has a lot of grandkids, because I swear there's like 4 or 5 of them that's always over there, and she's just taking care of kids that she knows that their parents have to work. And what else are they going to do if their childcare is closed? What else are they going to do if the schools are closed? You know, it's incumbent upon us, like I said, for us to stand in this together and to do what we need to do to make sure that we're okay. I appreciate that there are organizations like, you know, Urban Ministries, Families Moving Forward, you know, even with East Durham Children's Initiative that I work with. It's important to have those in place, but we've got to do more. We've got to figure out how to make this about development and make this about how we move in a way that doesn't repeat the cycle. I mean, it's not a hurricane, it's not a flood, so you don't see the impact like we did in like Katrina, but you can feel that it's going to be similar in how we come out of it. And the people who are going to lose are going to be those at the margins. And when those at the margins lose, it becomes violent. And that's how I mean, it's just, it has a ripple effect through all of us. We're all one, and we all have to do this together.
I would add to that, and I appreciate everything that Deidre said. I think she's exactly right. I think that polarity or polarization brings out the best and the worst of who we are. And when you talk about policy being a reflection of our values, what you're seeing right now is a place that is seeming rather than being, which is not in alignment with our motto of being rather than seeming. And Deidre's point is well stated. You point to any era in history, and I can show you how marginalized people band together and took care of each other, and how the people who suffer the most show quite often the greatest humanity. And if you look at what's happening today, those of us who should have the greatest privilege of being the most benevolent and extending ourselves the most are the ones that are literally beating at the doors to, let's disregard, let's go back to business, let's just continue with business as usual. It's deafening to hear that. When you talk about what we can do to really shift that, I will say this unapologetically, that politicians make decisions because they believe they can, period. And so whether it's my boss, whether it's the legislature that's coming back into session in the summer, whether there's local or national, when we talk about SNAP benefits, as Deidre, Councilwoman Freeman, I gotta call her Councilwoman Freeman. That's my sister, my first cousin. We got the same Uncle Phil. But when we talk about SNAP benefits, when Congress says that extending the benefits, but they're not for raising the level of protection that extends the welfare state too far. They don't want to go that far. I'm sure many of you have read that in the Times and in other pieces. In the state of North Carolina, our legislature has been debating this issue about increased unemployment insurance for people who are out of work due to COVID-19. And the House has a provision that they believe should be extended to North Carolinians, and the Senate has a provision. And we can get into a broader ideological examination of why the House and the Senate differ kind of fundamentally, with the House being more about kind of immediate welfare issues, and the Senate really being a body that protects property interests. But the issue here is we're going to have to become really nuanced, or continue to be nuanced, or like change the game and help people understand that like this is not a decision that can be made on the backs and juxtaposed to our community's interest. And what I mean specifically by that is we have to be able to say to leaders, hey, you're doing a really good job in trying to protect us. At the same time, you're not doing justice or mercy towards us by not extending us, not charity, not a handout, basic human decencies like healthcare, like quality education. 6 months ago, the state of North Carolina would have said that broadband expansion was a luxury. It's not like we don't have the capacity or the ability to do that. Within the past 6 weeks, we've literally taken routers and hotspots on school buses and sent them all across the state. We could have spent a fraction of the money that we're going to spend to build out the maps and provide digital access to people to shrink the divide, but it wasn't a policy priority. It was not a policy priority then. And what I'm saying is we have to show people that not only is this an issue that's been exposed by COVID-19, it's a policy priority. And like, we're going to vote on those issues. Like, we're going to, so proud of the new senator, Natalie Murdoch, got good representation from Durham with Zach Hawkins, and good heritage of leadership, Vicky Michaud and others I can name, everybody, but all across the state. Like, we're going to have to send our folks to Raleigh and say, hey, keep doing what you're doing. Like, keep showing up for Durham. But when you're in Raleigh, you not only are you speaking for Durham, you're working for all of North Carolina. So we need you to get your Democratic colleagues and your Republican across the aisle seatmates to vote in our, and I want to be really careful about how I use this language, in our and every community's interest. When you lift marginalized populations, everybody wins. When you lift issues of great importance to the Black community, to the brown community, to marginalized populations, trust me, like majority populations are going to win, probably even more. I mean, it probably won't even be a tit for tat type thing. But my point is, that's where we are right now. We are at a place where literally the bill that passed, that the governor signed into law earlier this week, set aside or allocated $50 million to rural and underserved communities accessing healthcare. That is a thing that appears to be really good. The question is how that will be administered and where those dollars go, and how many people in communities like East Durham or out in Martin County or Bertie County, how many folks that are suffering from those underlying health conditions will be able to access that? Not just a radio PSA, not just a leaflet that says, did you know that you can go to this place and get COVID-19 tested? Like, will we be dropping dollars into health providers who can go and service those communities and get them tests? And the other thing that we haven't talked about yet that this specifically implicates is our incarcerated population. And so what does this mean for people who are getting, I don't even want to ask a rhetorical question. COVID-19 is literally like setting a jail on fire. It's like setting a jail on fire and not letting people out. And so at what point does our humanity bring us to the place where we are willing to admit that we have this fetish with over incarceration, and we have some 20,000 people at this point, just under 20,000 people who will get out this year, who very likely have been exposed to COVID-19, who will go back to communities that may or may not have been exposed to COVID. And what does that mean for our public health system? And so how do we get these dollars into, and this shift in political ideology to get people to make decisions that are best for our whole communities.
Thank
Oh no,
you.
did I share? Okay.
Yeah. Cool. Yeah, this is a lot. This is a lot. Delvin, do you have another question? I'm almost about to be overwhelmed. Just, you know it, but to hear it again and to hear it from people who are on the front lines, in a sense, in the political realm and making decisions is just a lot. Thank you both for sharing. Delvin, did you have another question before we move to Miriam?
Yeah, I don't want to take up all the time because I can talk for days about policy, honestly. But
Yeah, well, yeah, that's why you're here. So go ahead, if you have another question, please. And then we'll go to Miriam, who is part of our staff at DurhamCares, also a DACA. And right now she is actually experiencing COVID-19.
yeah, so yes, it's just kind of.
I'm sorry, Del.
A lot of the theme about community and community being leveraged as a strength for Durham and for North Carolina. And oftentimes when policy fails us, it's the community that steps up and bridges the gap. At the same time, there's a lot of policies that are out there that in their own way break communities apart, whether it's poverty or mass incarceration or just the ability to keep families and communities together. And I think we're seeing a lot of that in a space like today where we have socially distancing. We're socially distancing to a way where it's already challenging to keep social communities together, even though we're not moving or breaking up in a geographic way, but still communities is a linchpin of what makes a community or makes a town or a city what it is. So with that said, Jeremy had brought up prisons and jails, which is, in my day job, I work at the Southern Poverty Law Center, and we're trying to decarcerate as much as possible, especially on a state prison level. And we're talking about how can we get as many people in a way that doesn't jeopardize public safety. But at the same time, you have to have a community in order for them to come to that is healthy and that can support them and doesn't push them into recidivism, it's a hard word to say, back into prisons. So all that said, I guess my next question is, hopefully we can learn from the history that we're making today with COVID. And after COVID is over, where do you think, either in Durham or North Carolina, the directions that we're going to have to go to help strengthen communities, make communities stronger, especially the Black and Brown communities that are most marginalized, the ones that are most most impacted by COVID today. How do we make these communities stronger, and how does policy help support that? Jeremy's pointing to Deidreana.
Can you repeat the question? I'm sorry, I was answering someone's panel question.
Yeah, so there's going to be a day where COVID is going to hopefully pass through, and hopefully people have learned from all the experiences we're going through now. In terms of strengthening communities, because community is the backbone of what holds us together. How can we use policies that strengthen communities and not break us apart in ways that policies sometimes do?
And I think I spoke to it a little bit of it in saying that we have to do this together. And so I started with the conversation acknowledging a situation that's very tenuous around racism. And I think that when we develop policies that focus on everyone and not equally, but equitably, we put those who are marginalized at the center. And whether that's rural or urban or, you know, Black or white, whatever the center is of that marginalized community, we need to make sure that we acknowledge it. And any policy that works to acknowledge those in the center that are experiencing it the most, I think comes across to have impact on everyone in a way that's positive. So it's almost like the, rather than acknowledging the rising tide, you know, scenario, you're looking at this as the kind of the storm that we're all in. And someone said that to me yesterday. We're all in this storm together. We just have different boats. And so if you acknowledge that, you know, you don't need to fix someone else's boat, they can fix their own, but you do need to make sure that they have the wood, the nails, and all the tools that they need in order to do that, then we're making sure that everyone has what they need. Because even though COVID-19, as I mentioned before, the big box stores will be fine, they're not gonna not experience a loss. They're gonna experience a huge loss. It's different, and how they manage it will be different. And we'll need to support that. In the same way, what often doesn't get supported is the smaller boats. And if those smaller boats aren't also supported because they have gaping holes or because they've fallen underwater, if our policy doesn't reflect an equitable approach of making sure that you put folks in touch with what they need the most, what they need access to the most, or the level of funding or resource that they need the most, then it's not beneficial. So I think that we'll see policy shift, and we'll actually do the hard work of figuring out what people need and how we can support that, whether it's with government funding or private funding, or, you know, investments, or just, you know, a bit of charity. I am confident that we'll be better tomorrow. We'll be better in this than we were before. I'm pushing my hardest for us to be better than we were before. I don't want to go back to the way things were. I don't want to have that old norm be the new normal. I am looking for better outcomes for folks across the board.
You know, I'll add to that, that we actually don't have to recreate the wheel here. Essentially, what we need to recover from COVID, which I'll say, all the models tell us that COVID's not going anywhere anytime soon. Even if we begin to re-stimulate or reopen the economy, there's an expectant spike in COVID cases in the fall. We baked that right into, you know, whatever we do later this spring or early summer, and so we will be dealing with COVID for the foreseeable future, and you know, we are questioning now whether schools will be able to go back in the fall. It's not a guaranteed thing. I got a lot of friends. I'm a Tar Heel. I got a lot of friends that are talking about how Carolina's got, you know, top 4 recruiting class coming in this year. And, you know, I'm in a little group chat, and I had to remind them, like we might not be playing football in the fall. And even if we do, might not be no fans there. But I'll say this, we don't have to recreate the wheel here. All we need this time around is an anti-racist New Deal. We know from the New Deal, 1934 to 1936, 37, that Congress has the ability to help people recover on a national scale. The only problem with the New Deal was it boxed Black and brown people out. And so everybody wasn't able to recover in the same incentivized way that majority populations were able to recover. I'm not arguing the New Deal was perfect, but I am arguing that we know how to take care of each other so long as we're not forced or compelled to take care of everybody. And so we talk about labor protections, we talk about protecting wealth, the opportunities to build wealth, the opportunities to access healthcare, the opportunities to fortify our financial resources, You name it, we know how to do that. The question for us will be, do we have the courage and do we have the values? Are we ready to identify as these United States of America for all of us to be prosperous, for all of us to recover equitably? Are we ready to extend our welfare state, our general welfare, as the Constitution calls for? Are we ready to extend that to every North Carolinian, to every American? And I would say we have the capacity to do it. The question, but my response goes back to what Delvin said earlier, which is, policy is a reflection of our values. And I'm not convinced that our values are there yet. I'm not convinced that's where we are. That's where we ought to be. And if you ask me the question, what will it take for us to be able to holistically and equitably respond and recover from COVID, I would point to the New Deal and say, we have the capacity to do this. I think this time around, such that history won't repeat itself, I think it should be anti-racist, and I think it should be extended doubly so to minority communities, because we have to recover at a place greater to become equitable with other folks in society.
And if I could just add on to that, I appreciate that term. I will be using it frequently, the anti-racist New Deal. I think that Dr. Sandy Darity and his wife, Kirsten Mullen, explained that very well when they explained how reparations are actually due in this conversation. And just looking at how the COVID response, trillions of dollars have magically appeared, we know what's possible. We just need to know that our values align with what we say, our Constitution and our Bill of Rights say. And if we're ready for this, then we need to push in and lean forward. So I really appreciate that language. I will be using that going forward. I also have to add that I do have to leave. I have another call to jump on and I have to give an introduction. But I appreciate being here, and I appreciate you all hosting this. DurhamCares plays a vitally important role in our community, and I'm grateful to Reynolds and Tammy and Delvin for all the work that you do. And keeping Miriam in my prayers, as I understand how hard it is to go through a COVID-related recovery. I've had some folks close to my family experience hospitalization and all that comes along with it. I want you to keep in mind, as I know this is a praying group of folks, that these folks are in the hospitals alone and they are not allowed any visitors. So their families are not seeing them when they pass. And so when we say that almost 500 folks have passed in North Carolina, those folks are passing often alone, and some at home alone, which is even worse. So I just want to leave you with that. But thank you. And if there's any questions, any follow-up that's necessary, please know that you can reach me with the City Council or in the community. And I'm sure that they'll share my contact information, whether it's my equitable equality email address or my deidreana.freeman@durhamnc.gov. Thank you.
Thank you so much, Deidreana. Have a good day. I'd like to welcome Mr. Hayes, Mr. Tony Hayes, who is the tribal chair of the Occaneechi Band of the Saponi Nation. And Mr. Hayes, we're going to jump right in with you. And the question that we have been discussing so far is the question of how is this, with the work that you do, how is this impacting your community? How is this impacting the work that you're doing, this pandemic, the COVID-19 virus that we're dealing with?
Well, Ms. Rodman, thanks so much for having me. I appreciate DurhamCares, including the Occaneechi Band of the Saponi Nation. I will say Mr. Collins is going to be a hard act to follow. I think the New Deal for minority communities is pretty powerful. So I have not heard it termed like that, but Mr. Collins, I'm going to be plagiaristic, and I'm probably going to spread your message to the Indian communities. It has impacted Indian communities in a really, really horrible way, because first of all, for those that don't know, North Carolina is the most populous American Indian state east of the Mississippi. There are 8 tribes here. Everybody knows the Cherokee. Most people know the Lumbee, but there are 6 other tribal communities or tribal nations that reside in North Carolina. And even the Cherokee and the Lumbee are isolated in fairly reclusive rural communities. We have the tribal governments are all nonprofits, and to date, none of the stimulus money or none of the relief packages include tribal governments that are not federally recognized. So we're pretty much out on that island swimming around with the sharks, not knowing what is going to happen to our communities. We have a pretty robust elder population in most of our communities. And again, being somewhat redundant, you know, we are in very rural areas, so we still may have to drive 30 to 35 minutes to go to the grocery store. So, you know, even though that is I guess a mini advantage in the fact that we're socially distant even before this, you know, we know how to practice social distancing very well because we're pretty much in these pocket communities. But again, with that sort of being the setup, the Indian communities came together last week. All the leadership came together last week on a call with the state, asking the state and the federal folks for support because we're being left out, as well as most communities of color are being left out. You know, on one of the boards that I serve on a board for a minority economic development organization or a community development organization that provides business loans. And it's just really horrific of how, you know, a lot of this money that the relief packages have been set up for are not getting it. I think that, you know, the rural communities and the minority communities and the rural businesses and the minority businesses, you know, are certainly at a huge disadvantage prior to COVID, and certainly are on the front line of disadvantage after COVID. And we should be first in line for this relief money. And I'm sad to say that we're not. And I see that firsthand from a professional standpoint. I also see it from a tribal community standpoint. And, you know, to echo what Mr. Collins was saying, you know, I think now's the time, and Ms. Freeman was saying that, you know, it's amazing how all this money pops up, you know, and we're dispersing this money. But, you know, I'll be honest with you, even though I like a good steak, I don't really think Ruth Chris should get the money over some of my tribal constituents. You know, we are just doing everything that we can to bring awareness to this, not necessarily just for the Indian communities, because we live in larger communities, and we want to make sure that everybody in our communities are included, because it is really important that we move this ship together. And I think, to be honest with you, as I like to say, even though there's a lot of myths and misconceptions out there about Indians, most people of color have the same problems. We're pretty much not part of the machine, or we're not at the table in a lot of instances. And we just really have to dig and fight and scrape for all the things that we have. And I think that now is a time that we need to really stand up and let our voices be heard, not necessarily just as one community of color, but all communities of color. Because I think, you know, there's power in numbers. And so we're ready, willing, and able to add our voice to the mix and create this quote unquote New Deal for, you know, what we're doing right now.
Thank you, Mr. Hayes. Delvin, do you have a question? Any questions for Mr. Hayes?
Just maybe a reiteration of a previous question. And we had talked a lot before about community and how community maintains itself in times of crisis, especially when policy is creating disparities or not really supporting communities that in a way that they should. For communities like yourself, for Native Americans and Indian tribes, especially living in rural places where you're physically spread apart, how does communities like yours tend to support itself in times like this where you're supposed to be social distancing and you have all these other issues with poverty and so on and so forth? How does the Native American community bond together? Like, how did they survive, and how did they, keep communities intact?
Well, Delvin, that's a really great question, and let me sort of address it in a two-part way, since it's really a two-part question. First of all, we're trying to figure it out like everybody else, because all the ways that we generate revenue have been cut off through the state executive orders, because most tribes that are non-federally recognized generate revenue through events. They generate revenue through community gardens. Several of our tribes have housing programs, but not all the tribes have housing programs. So if you don't have a housing program, you're basically generating revenue, on a ad hoc basis. And our biggest revenue generator for our tribe is our powwows and the local educational events that we do, partnering with the schools, doing things of that nature that are really not COVID friendly. And we can't do that now. We've been restricted from doing that. So to answer your question, we really don't know how we're going to generate revenue. That's sort of part of the ongoing calls that we're having, because we really aren't considered a standardized business. So that's why I was saying earlier that as a tribal government, there's nothing in the relief packages that basically support local or tribal governments. And so we're really trying to make the case that we've been not able to create revenue because of all the restrictions. So we're really trying to figure it out. Now, the second part of your question, as far as what we're doing, first of all, Indian people are very, very sensitive and very honoring of their elder population. So we're making sure through phone calls, through Zoom calls, through conversations with friends and family, that we're checking on our elders as best as we can. We're monitoring pretty closely any COVID cases in the Indian community. And sadly, we have in the various 8 communities, I think there have been around 70 cases of COVID that has been discovered. Fortunately for my tribe, we have no known cases at this point. So we're really blessed and pleased that we took this seriously early on. We're the first tribe to back away from doing any kind of social events prior to the governor's executive order early in March. So we're doing everything that we can to protect our citizenry. And we're just, doing all that we can to reach out and put our virtual arms around all of the members in our community to make sure that everybody's safe. And we're practicing all the necessary precautions to make sure that they remain safe.
Thank you. Jeremy, did you have a question or something to say? Unmute him. Okay.
Yeah, well, I think I just unmuted myself. I want to make sure that, so much respect and love to Brother Hayes. I'm hoping that I think he knows Greg Richardson, who is our Indian Affairs Commission chair, or executive director, I should say, and Quinn Godwin, who is Chairman Godwin's son, is one of our colleagues. I want to make sure that we connect when we talk about adding voice and building community, because we have to put that information in front of folks. And so as these conversations are happening, I would love for you to be looped into them regularly. So, if we're talking about advancing something and it's a communities of color initiative, certainly our American Indian population, our Native American population kind of our elders. I listened to you talk about how you care for those that are most vulnerable in your population. One of the messages I carry back to the governor all the time is it's not communities of color that you got to worry about. Will we wash hands? Will we social distance? Will we honor the guidelines that have been set out? You're talking about a legacy of people who have put others before themselves since the beginning of time. And what he's talking about is exactly that. But definitely, whether offline or I want to get your email address, and maybe Quinn or Greg already has it, but I just want to make sure we all looped in, because we are going to be moving forward in a policy space over the next couple of weeks. I want to make sure that you're kind of in the loop.
Yeah, Jeremy, I appreciate that. And I am a sitting member of the Commission of Indian Affairs, so I know Greg really well.
Good.
Quinn and I go way back. I work pretty closely with Harvey and Tribe. And also one of the areas that I try to help the Indian community is that I'm the chairman of the board of Carolina Small Business Development Fund, and also the chairman of the board of NCI Fund, which are basically CDFI organizations around the state that's helping small business. So we were on a call last week with state officials, and I want to make sure that we're lending our voice to those said communities that may not be getting any love or attention or being overlooked in this horrible pandemic. But thank you so much for being willing to connect. And Greg definitely has all my information.
Thank you. Thank you so much. I want to now bring Miriam on because she's actually going through the virus right now. And I think what she has to say is a powerful statement as she speaks for herself and some of the things that she's seeing in her community. Miriam, are you with us?
Hello?
Yes, yes.
Hi everyone.
Yeah, introduce yourself.
Yes,
And, yeah.
I'm Miriam. I am part of the team at DurhamCares and also work with other nonprofit organizations here in Durham. And yeah, today I want to, Tammy invited me to share a little bit about what's been going on with my COVID situation and how it has affected me and how it's affected my community too. I'm Hispanic, Latina, originally from Mexico. I work a lot within the Hispanic Latino community in one of the organizations I work for, just advocating and trying to help find resources. And through this pandemic, I had been working from home, and I had my partner who was an essential worker and had to work and come home, and then my daughter was working at a retirement home. And I thought that I was safe home because I wasn't going out. I've only been out once since the stay-at-home rule came out, and it was like back in March 30th. I went to the grocery store, and when I had that trip over to Harris Teeter, I realized how some people were not taking this seriously. There was no social distancing. They were like just walking by you as if they had no care in the world. It was to me at that moment, I just couldn't believe how people were just acting as if this was not a serious thing. Thank God that during that time, nothing happened, but 2 weeks ago, I started feeling really sick. My partner started feeling really sick, and he had a cough, and he had a fever, chills, and he doesn't have health insurance or a healthcare provider. but I had been doing some research about like Duke Urgent Care to see if there was someone that we could call to see if he could get seen. And of course, that we were able to do an e-visit, and he talked to a doctor, and of course they said, assume you have COVID. They sent medication in. They couldn't test him because of course he wasn't dying, and also because he didn't have any underlying health issues. And during that same time, I also started getting sick. I had symptoms too, and I called my doctor. I do have a healthcare provider. I don't have health insurance. I have to pay out of pocket. And my doctor also said the same thing, assume you have COVID. At that time, they told me they couldn't test me because I wasn't having any serious health issues with not being able to breathe, and also like I didn't have any underlying health issues. And throughout this time, I realized that a lot of people in my partner's family, they were all getting sick, but they didn't have the resource as he did of someone calling in for them to getting them the help that they needed. So they were all getting sick, and they were all thinking, oh, it's just probably the flu, or it's just us being sick. So of course they try to like the remedies at home and like try to stay home. And that's just like another group of people that are basically not being taken care of, and are just basically don't exist because no one is paying attention to them. And that's one of the things that, you know, they had shared with me, like no one is really paying attention to us. Who are we going to go to? Like we probably go to Lincoln Lion Park, but they're like the language barrier is there. Like because they feel so helpless, they just stay home and just get sick and hope for the best. So throughout the time, we also got sick, and on Friday, I had another health issue, which led me to go to the hospital. So I had to go to the hospital, and while being at the hospital, they tested me for COVID, and of course, it was positive. And I had been around, of course, like my daughter and my partner. And before I found out that, before I had my symptoms, I had been around like my brother, because I'm like the person who kind of like takes care of my family, like my mom, my sister, my brother. And after I tested positive, of course, I told them to test themselves because they work at the healthcare providers retirement home. And my daughter tested negative. I tested positive. And my brother tested positive too, which means that also the people in their house, which is my sister and my mom, also were probably sick because they did get sick at some point. But of course, they couldn't get tested. And at some point, my sister got misdiagnosed with something else instead of saying that it was COVID. So it was really frustrating not being able to get tested, and in the beginning when we got sick, because I mean, I understand there's not a lot of tests, and they were giving priority to people that were really sick, but this was just like a little reminder of like, maybe I'm Hispanic, Latina, I'm not really a priority anyways because of who I am. So it made me, at that point, I think it just makes you think, you don't want to think about it, but I mean, it is real. Even before COVID, it's always real. Like people of color and my community were always ostracized, marginalized, and we don't get the same attention because there's always these biases of like, you might not have health insurance, you won't be able to get pay. I mean, I had this issue before finding my health care provider. The reason why they didn't want to take me in was because I was uninsured, and because I was Hispanic, they saw my name and they thought I wasn't going to be able to pay. But I had an advocate who went in the clinic, and this was through UNC. They fought for me. I was able to get in, and thank God that I found a really good doctor that's been helping me out. But but this has been a really stressful time for me, just because while being sick with COVID, I also got sick with another issue. And now that I have this other health issue, they don't want to see me because I have COVID. And I'm here thinking, well, when I was in the hospital, they said, we're going to send you to this clinic where they're dealing with patients that have this issue and are also dealing with patients that are COVID positive. So you're going to be able to get seen. So the urgency that the emergency room said to me, like, yeah, you're going to be able to get seen. And then waiting to get called to get an appointment, I find out that you're not going to get seen. I'm hearing a different story now. You have COVID. We don't want to see patients. We're nervous about seeing people right now, which didn't really make sense to me, because they had just told me in the hospital that this clinic was specifically for people that tested positive and had the measures to deal with them. So again, I felt dismissed, and I made it known to my doctor and the nurse practitioner that calls me every day to make sure that I'm okay with COVID, just the COVID situation. And I'm like, I feel like I'm being dismissed. I don't want to think that it's because of who I am, but sometimes it's hard not to think that way because of the reality of things. It's just not me, but I also see it in my community. I see it around the people that I work with, the families that we serve. You know, when I'm talking to them too, they're like the same, like, I mean, I'm going to get sick, but I'm not going to go to the hospital. I'm not going to call a doctor because I don't have a doctor. I don't have anyone that could help me maneuver this COVID situation. And as time continued, while I was sick with COVID, we also found out that my partner's family in Maryland, they all got sick with COVID too. And one of them almost lost his life because he got really sick. And the same thing, like they're not, people are really not, I think in my community, they're not going to go to the hospital unless they say that they're dying, and they're even scared to go because of all of the things that they're hearing, and like people dying and dying alone. And then you have that on top of being Hispanic, Latino, and then on top of that, the language barrier. Like even when I went to the hospital on Friday, like the assumption that I was Latina and I didn't speak English was so rude and disrespectful. Like, and it was so crazy because then they gave me an interpreter, and I was like, I don't need a translator or an interpreter. I speak English. And that was kind of rude and disrespectful for y'all to assume that I didn't understand. And yeah, it has been a little struggle, but I'm believing in God that He has the control of everything and this situation. And the reason why I decided to come was because thanks to Tammy, who encouraged me, but also just to, if anyone in my community is listening, just to let them know that this is real, that this is not fake, this is not a joke. Sometimes people might think that this might not be real because it hasn't touched you or your family, and you haven't seen anyone that you know that has been affected. And I feel until the moment that you see it like affecting you, then you start understanding. And I think for me, maybe at some point I felt like, oh my gosh, is this really real? Then when I started seeing the symptoms and when I got sick, it was horrible. Like the 4 first days were horrible. Like I just can't even explain how that felt. And it was also kind of scary because you're thinking about, oh my gosh, what if I have trouble breathing, or what if something happens and I have to go to the hospital, and thinking about who I am basically like the whole time. Like, I'm Hispanic. Are they really going to care about me? Are they really going to pay attention to me? And I think if I'm worried about this and I know the language and I work in a professional setting, I can only imagine what my community feels and what my people feel, not knowing the language and not knowing how to advocate for themselves. Yeah, so it's I hope that this brings awareness of those who have a voice to speak up and like advocate for those who don't. That's always something that I say. It's really important for people who have the power and who are in a place of power to be advocates and use that gift to be advocates. I try my best to do that. But sometimes even those who like are advocates have to go through it. Like it happened to me, and at some point I was like, oh my gosh, I have to slow down, calm down, take a break in order for me to continue to serve my community. But thank God that I'm feeling better now. I did lose the sense of taste and smell, and it's going to take about maybe a month for it to come back. The health department is checking on me every day. UNC people are checking on me every day, which is really nice. I get to talk to someone and share with them about my symptoms. But it's still always a little bit nerve-wracking. But that's what I wanted to share with you guys today. And thank you so much for listening. And I hope that, yeah, this brings awareness to the community, our community, and we continue to be advocates for those who don't have a voice.
Thank you, Miriam, for sharing. Our time is running out for today, and I just want to thank each and every panelist that has been here this morning with us. My heart is overwhelmed, and I just thank you. Delvin, do you have any last words before we close out?
Yeah, I also want to just thank everybody that took the time to share their story, and also all the participants that were just tuning in to listen to the story. One of the things that we wanted to kind of thread between all four of the sessions is just kind of paying attention to like whose story is being told. I think along with that, it's also important to pay attention to who's listening. I think a lot of what I've heard from Mr. Hayes and from Miriam, you know, it's not surprising, but it's the first time I've heard articulate from their voice in a way that, you know, how all this is impacting them personally and people like them. So it's not like, you know, people are just voicing their concerns for the first time. While opening up a space like this where they can voice their concerns and have people listen to it is also important. So I do advocate for people voicing their truth as much as possible, and also praying for people to listen to those voices, because that is a strong driver for policy and community change. So thank you for everybody that tuned in, both the panelists and the participants that were listening in, and we will move forward.
Yes. Well, if you are able, please join us next week as we will have a conversation as to racism and how it's impacted the Asian American community, as well as the Black and Latino, all those who are marginalized. So we will have that conversation next week at 11. So please join us at that time. If you need the link, please go to our website, DurhamCares.org, and that will be provided for you. So thank you. I pray continued health and blessings over you, each and every one of you, and we'll see you next week.
Thank you.
Thank you.
Thank you.